Welcome to Broome County Childbirth Advocates, our monthly meeting. I'm Amy Lynch. I'm a registered nurse and I'm also a doula and educator. Really quick, want to mention our upcoming events, which will be infant massage in July and breastfeeding in August. September is not quite on the books yet, but it might be nutrition or something along those lines. But today, we're going to talk about easing the discomforts of labor. And I'm going to talk about the natural methods that can be used. And then we have Katherine Kim who will be talking about some of the medical things that you can do in the hospital. But real quick here, we've got our mission statement for Broome County Childbirth Advocates. So our mission is to provide awareness, support, and resources for parents, expectant parents, and birth providers alike. So we strive to educate the community on all available birthing options, procedures, and practices. And we look to create a network of professionals who understand the vast array of options available so that ultimately families can have the best possible birth experience of their choice. So what that all means is we want to educate parents, but also other professionals as well. So comfort measures for labor. This is my youngest baby, Blaze. We've got a few tools that I brought here, and I'll point some of those out as we go along. First of all, I want to start with fear. So,
that's it.
Right. What are your fears? And I mean, so Amy, if you want to answer, you can. But what's your biggest fear as far as going into labor?
My biggest fear since my second was just the pain of delivery. I mean, it was the worst.
The actual birth.
The actual, right, not labor, the delivery was so painful. And with 2 epidurals that didn't work, I think made it even worse. So that's, like with this one, I'm kind of, with, the last one, I didn't have the pushing, my body didn't help me push. I never had that sensation to just push.
Yeah.
So I had to do all the pushing on my own, and that was hard. So now I'm kind of like, should I go with an epidural? But what if it doesn't work because it didn't work before? So I guess that's my fear. I don't know what I want. I don't know what's going to work, what's going to help me.
Yeah. Okay. And we'll talk a little bit. I don't want to, pick on you right now, but about some things. Anyone else want to share fears?
I fear a C-section actually, and something going wrong, anything going wrong, with either me or the baby or both.
Yeah. I think that's really common.
And of course pain, I remember that. And I didn't have an epidural, so.
Yeah.
Well, they didn't work, so I felt it all.
Felt it anyway, yeah. And what about you? Do you have anything in particular with it?
No, we're scaring her.
She wasn't afraid.
I think sometimes just acknowledging what it is that, is your fear is a big step. And yeah, that sort of face that, that we see on TV a lot too, I think is sort of ingrained in us that labor is this awful, horrible thing that we have to dread. Versus looking at, what could pain actually be telling you about what's going on in your body during birth. So I have a little quote here that I have up on my website. So, labor is powerful and intense, but it's the joy of birth that's overwhelming with love. I think sometimes we use different words than just pain. So let's talk about labor being hard work, being very intense. Can feel overwhelming at times, but if we sort of can step back from that picture I had on the last slide there and think about what's really happening. So I just want to start with, so what are some ways that in the past you've done to handle pain? Is there anything that can just be something simple like a headache? What helps you with that?
Well, I don't like to take medicine, so it really it has to be bad before I get, even in labor, it has to be bad, before I even get anything. So, I just kind of suffer through as long as I can.
I mean, do you use things like heat or, massage, rubbing your temples?
Actually, I don't. With the last, my husband and I had another support person, they kept rubbing my back, and I was like, leave me alone, don't touch me.
Okay.
So, I
Yeah.
do like to walk around and be active during my labor, but once, like, transition starts, I have to be in the bed, and I don't know if that hinders me, maybe?
I mean, I think there comes a time when a lot of women feel like they just want to lay down and not be quite as active, yeah. So, and sometimes sleep is what we do to deal with pain, so that can be part of that, just laying down and being still and not moving. But I think a lot of the things that you know work for you, whether it be massage or sometimes heat to something, if you like candles and nice smells and those sort of things, you know, keep those in mind as you go into labor. Those are going to be the same sort of things that probably are going to work well for you in labor. And it could be solitude, don't touch me.
I got to that point too.
Yeah, I think a lot of
And
it
in the
too.
beginning it's okay, but once like everything hurts, you're like, just don't touch me.
Yeah.
And everybody shut up. One in silence.
Is there anything that you would say just other than labor is really helpful for pain for you?
Well, I get migraines and I do
Okay.
use medicine for it, but a cool, dark room, quiet
Mm-hmm.
is what I need for that.
Right.
I can't think of any other like pain situations
Yeah.
that I've ever really been in other than labor.
But yeah, a cool dark room is definitely, you know, prescription for labor, I think. This is a picture, an example of a picture that I like to think of labor, you know, just sort of calm, relaxing. She's had a support person there, versus that prior picture that she's just sort of screaming. So a few things to remember about pain. Pain is purposeful. You know, pain is telling your body something's wrong, or maybe something needs to change, something is happening, something's going on. So it's not just this awful thing that's happening to you with no purpose. And truly in labor, the purpose is birth, so your body's getting ready to have a baby. Excuse me. Also in labor, it's anticipated, so contractions usually come with a fairly regular pattern. So once things sort of get going and you know, okay, my contractions are coming every 5 minutes now, you know, you've got your rest time in between, and you can sort of anticipate when that next one is going to come. And get ready, whatever position is working well for you. If it's sitting on the ball or laying in bed, you know, let's say you just went to the bathroom, okay, there's another contraction coming, let me get in my spot where I know I'm comfortable. So that can be helpful. It's intermittent, so the pain of labor isn't 12 hours of just agony. You have your contraction and then you get a rest. So if you can sort of think of it that way, one contraction at a time. I'm going to do this one, I'm going to breathe through this, and then I get my rest. That can be very helpful. And then the end, so normal. It's normal to feel a lot of different sensations in labor. You're feeling stretching, you're feeling tightening. It's not necessarily a sign that something's wrong, but there's a big change happening. And you get this at the end. So just to sort of keep that in mind, sometimes we sort of lose focus. You know, it can be helpful to have an ultrasound picture, baby's first outfit or something right there with you when you're laboring to sort of keep in mind, this is what this is for. We probably talked about most of the things on this slide, but pain starts to tell the body something is wrong or something is happening, something's changing. During labor, sometimes it means a different position. Women who have, you know, that back labor sometimes need to get on their hands and knees to relieve that pain. And so sometimes it's a signal we need to change positions. And you mentioned not really feeling that urge to push. Maybe a position where you're more upright and gravity is helping a little bit more would just sort of give you more of that feeling versus laying down, you know. So sometimes it's changing position, finding that the right spot where you might not be free of pain, but you're more comfortable. So really listening to the signals that your body's giving you. And then our vocabulary. So labor's more than just pain. What are you feeling? And this was really helpful for me, was just to sort of close my eyes and think about what was happening during the contraction. I felt a lot of tightening, I felt a lot of stretching, maybe there's some burning, aching, but just to put some other terms to it and think about what was actually going on as far as some dilation, and that was more helpful than thinking, oh, ow, this hurts so much. Okay, I feel a lot of stretching, I feel tightening, just to close my eyes and do that was very helpful. And the last point up there, just allowing your body to relax. Your uterus is doing a lot of hard work, so if you're tightening up anywhere, you're really creating unnecessary pain, more than just what's going on with the birth. So as much as you can keep, your abdomen relaxed, other parts of your body relaxed, will really help causing additional pain as to just what's happening as far as the birth goes, the birthing process.
I remember that my labor support said to put all my stress in my hands.
Okay.
To just grab something tight, or just make it all in my hands and relax the rest of my body. And I think that did help.
Yeah, sometimes if you just can't completely relax everything, right? If you sort of focus it somewhere other than here, I think, you're keeping a lot of tension in your belly where your uterus is working, you're going to have a lot more discomfort than, squeezing something. Here's just a few examples of things that you can do. I think the first is sort of create your environment. And you can think about this at home if you're laboring at home for any time before you go to your birthplace. Where are you comfortable? What room in the house? Is it your bedroom? Is it the living room? Where do you picture this happening? The lights, so a dark room. Usually, dim lighting is helpful. Music, what do you like to listen to? And what is relaxing to you? It doesn't have to be classical music. It can be what's relaxing to you, whatever that is. Whatever makes you comfortable and feel good. And aromatherapy, and I brought just a few examples. These are some things that I bring with me to births. So these are essential oils, and these tend to be a little bit less irritating than some synthetic, like some lotions and things that have other smells. I usually just bring some cotton balls, and I'll put a little bit of lavender, it's very relaxing, or peppermint if you're feeling nauseous, on a cotton ball, and then you can just smell that, and you can sort of just get your mind into another place. And then if it does get annoying, you can just throw this away and get rid of it, versus a lotion that you might put on your skin and then you just can't get rid of that smell if it bothers you. So these are really nice. Lemon is another one I like, because it's very invigorating, uplifting, give me a little burst of energy. You can do those at home, you can bring them with you to the hospital. They don't take up a lot of space, so they're really nice. Where are you giving birth? Are you giving birth at home? Is it in the hospital? Do you feel safe there with your care provider? I mean, those are things to think of ahead of time, but really you need, wherever it is, you need to feel safe and really trust your care provider and your support person. So who's coming with you? Is it your husband? Is it your mother? Your sister? I mean, whoever it is, that you're comfortable, that you know they're going to be there. Privacy, I think, is another big thing as far as inviting people to your birth.
Disinviting.
Or disinviting.
That's people to leave.
Yeah, I think that's a really good point, is not to be afraid to tell people that you don't want them there. Or, I'll call you when I'm ready for you to come. And that might be after baby's born.
Yeah.
But I think some privacy is really important. You might just want, one other person there with you and not your whole extended family. And some people like that. I've been to births where they had everybody there and that was what they were comfortable with. So that just depends. Some physical things, so that could be positioning. So, going to a birthing class and learning about some different positions that are helpful, and using gravity to sort of, help bring your baby down. Counter pressure or hip squeeze. So you'll need some help with this one, but you could do something just as simple as a tennis ball and just have someone pushing on your back. And as baby moves down lower, you might need to move this wherever that spot is, but sometimes, and it could just be the heel of your hand. A tennis ball is a little bit firmer. Just put some pressure there. You can have someone squeeze your hips, and it's right at the top of your hip bones here. And just have them sort of push in. Feels good. It takes off some pressure of the baby. And you can be on your hands and knees. You can be sort of in any position wherever you're comfortable, and just have someone come from behind and just push in on your hips. Massage, and it doesn't have to be anything fancy, but wherever you like your back, usually your back. Usually don't want your belly rubbed a whole lot, but some massage, rubbing your back, usually it's the lower back. Eating and drinking can be helpful, especially in early labor. As you're getting more active, you'll probably lose that, wanting to eat, but continuing to drink. So you're staying hydrated, you're getting a few calories to keep your energy up. Especially drinking, I think is important to remember and not to forget that. So heat or ice, sometimes helpful. I always bring a little rice sock with me to birth, something you can throw in the microwave. Usually can't plug anything in at the hospital, so this is helpful. You can put it on your back. Sometimes your lower abdomen this can be helpful.
Did you make that one with a sock?
Yeah, it's just a sock and
Right.
some rice.
Okay.
Really easy to make, yeah. Or ice. So you can usually have something at the hospital, but I usually bring some gallons of black bags you can fill up with ice, and then you can do that on your back as well, or at home if you're still at home. I did mention massage, but I didn't show my props here. So I have a few massage tools. Sometimes hands are all you want, but whatever sort of massagers you have, bring those along or have them even just at home before you leave. You can use them at home. I also didn't show my lighting. So at home you might want real candles, but if you go to the hospital, definitely not allowed. They're just little battery operated candles. It's not exactly the same, but you can turn off the lights in the room and just have, some dim light, and creates a nice atmosphere. So I always bring these with me when I go to birth. The last two up there under physical, so I have walking and then rhythm or rocking. So sometimes having some sort of movement is helpful, especially in early labor. So to keep yourself busy, don't just watch the clock and time every contraction, but go for a walk or go to the park if there's one close by. If you want to be at home and you don't really want to be outside, do you have a rocking chair? Sometimes just that rhythm of rocking or bouncing on a ball is really helpful. Water therapy. So I think water is very helpful during labor, and it's relaxing. A lot of people do take a warm shower, a hot bath, for pain other than labor. So during labor, why not take a bath, take a shower, and just let the water hit your back. That's where you're feeling the discomfort, or your lower abdomen. Consider a water birth. I've had 2 water births, and it was definitely amazing. I was upset that I didn't do it with my prior births, but it just really helped me to be able to relax and just sort of, let the labor happen without, fighting against it at all. So mental and emotional, and that's also my son Blaze. So what can you do mentally? And part of that is, the fears, sort of facing those fears, and even if you don't do anything about it, just acknowledging that, this is a fear I have. Excuse me. But you can do some visualization exercises. Really think these are best. I have just some scripts here, this, waterfall at the beach, different things, different little poems. If you practice them ahead of time, so that when you're actually in labor, you don't necessarily need someone reading to you, or you don't need to focus on reading, but you've practiced it enough that during contraction you can just close your eyes and you know it. You can, put yourself at the beach and do that beach scene, because you've practiced it a bunch, and it's really easy. Words of encouragement, so whoever's there with you, talking to you, telling you things to encourage you. I really think it's a good idea to write down some affirmations, things that you want to hear, instead of someone just saying, oh, you're doing such a good job. You're doing a really good job. Write down a few things that you think would be helpful to you, and then give them to even the nurses at the hospital, or your doula, or and your husband, whoever's there with you. Positive thinking. So when everyone wants to tell you all their horrible birth stories, don't listen. You can just say, only if it's a positive story. I don't want to hear anything negative. I'm trying to stay positive about my birth. I'm positive about the experience I'm going to have. Prayer and meditation, again, if it's something that's part of your life and that you've been practicing some meditation, or you have prayers that you really like, I think it's much easier during labor to do something that's a habit for you. I think I mentioned focus point a little bit. That could be like an ultrasound picture, a baby's first outfit, something like that can sort of keep you focused on, what your goal here is, the baby that's coming at the end. And then early labor distraction. It could be watching TV, it could be whatever. I think distraction can only go so far during labor, and then it doesn't really work anymore, but it can be great at the beginning.
Yeah, Anna was born during a Yankees game that my husband didn't turn off the whole time.
And were you distracted by it?
For a while.
I'll say after a while, distraction just, you're too focused into your contractions to really get distracted from them. Yeah. I bet he was really distracted.
He and Dr. Lucibo.
Oh yeah. I find that with the doctors.
I remember the nurse going, doctor.
Let's talk sports during birth. I just think, what? I don't think she really wants to talk. So breathing is a big thing. Always see in the movies and TV women doing this sort of all sorts of pattern breathing and different things. From my experience, I found that just really deep, relaxed breathing is the best. It's hard to remember the patterns, and I think they're more of a distraction than actually really helpful in getting through contractions. So just really deep abdominal breaths, not up here in your chest, but if you're keeping your abdomen relaxed and breathing into your belly, it's going to help you relax these muscles and just let your uterus do its work. If you're having trouble remembering to take deep breaths, you can have someone just place their hand sort of on the side of your belly, and that can be a reminder to you, okay, I've got to take some deep breath down here, not these sort of short little breaths that you can take in your chest.
That make you dizzy.
They make you dizzy, exactly. Sometimes as labor progresses and gets a little bit more intense, a little bit faster pace during the peak of that contraction can be helpful, as long as you're not hyperventilating. So sort of follow that wave that you have. Start with some nice deep breaths, and then as that contraction builds up, then you could do a little bit faster. I think we sort of naturally do that because we're working harder, and then as the contraction starts to go back down, make sure you're really getting those nice deep breaths in. You want to make sure baby's getting oxygen, so you're not holding your breath and you're not hyperventilating.
I've had that problem, holding my breath.
Holding your breath, yeah.
People always want to hold their breath. When they're
Yeah, so sometimes having someone just, if they, whoever's there with you, notice, just, put your hand on the belly. Okay, I need to take a deep breath here. Like I said, the pattern breathing can sort of be a distraction, but it could turn into hyperventilating if you're doing that. It just seems more of a tense type of thing to me, but if you learn it and it's helpful, then go with what works. So having a doula, certainly, whoever is your support person, your partner, your husband, having them with you is important. But a doula is someone that, it comes from a Greek word, that word doula. It's a woman's servant, or a woman who serves. So someone who's experienced, knows a lot about birth, that is going to be with you from the beginning until the end. different from the support you're going to get from your care provider, your doctor or midwife or a nurse. They're sort of going to be in and out, and they might have more than one patient. Not that they can't give you good care, but having that continuity from the beginning of labor to the end makes a really big difference for a lot of women. They've actually done studies where just having a woman sit in the room who doesn't talk to you and doesn't touch you, women felt more satisfied. They had a higher rate of natural birth, just having someone there with them, the same person, throughout their labor until they gave birth. So to actually have someone with you who is rubbing your back if you want it, who is giving you some suggestions, who is talking to you, giving you those affirmations, is going to have an even bigger effect. I think an important note about doulas is they're not there to take dad's place, but to really support both of you. Sometimes they offer postpartum support as well. And definitely studies show that having a doula increases your chance of having a natural labor, a shorter labor, natural birth. So we'll just sort of end here with a quote that I really like. It says, "The instant of birth is exquisite. Pain and joy are one at this moment. Ever after, the dim recollection is so sweet that we speak to our children with a gratitude they never understand." Something to think about. And I've got a handout here with some things we talked about, some additional things I didn't get to. Start down here in this little pyramid. So early labor, active labor, pushing. And you can still use these things, can sort of filter through, but just to give you a starting point. And on the back is a little just relaxation exercise that you can practice. Thank you. Any questions or anything, or comments? Any things that helped you during labor that I didn't talk about?
Well, it helped when my support person would, say, okay, you're getting ready to have a contraction, and then she would just count, and she'd say, okay, you're at your peak, it's gonna start going down. So that really helped, because I knew,
Right.
at this point, it's gonna get better.
It's starting to go away. Yeah. So sometimes timing them and having someone on top of that can be really helpful.
Right on, my husband would be like, what do I do? I'm like, I don't know. I don't know what I need to do.
That's why I also think it's important to have, if not a doula, like another person in the room that's not your significant other, because they're going to be the first to cave when if it's a matter of making you comfortable. So like if it were up to my husband, I would have had pain meds, epidural, knock me out, pull the baby out, because he just didn't want to see me suffer. So if you have someone else there that knows your plan, that can help you stick with it, that knows that it's going to end, it's better. My husband was much better the second time around, but the first, we needed someone else there that could stick to their guns, because you get to a point where if someone offers to hang you from the ceiling, you'll do it if you feel better. So even if you don't want any meds, if someone offers it to you, you're more likely going to take it if you have someone there that can. So even if it's not a doula, if it's someone there that can really, other than your significant other.
That's a good point. Well, if there's nothing else, then we'll Katherine
Wilson, and we're going to cover kind of recap some of what Amy talked about, but specific to what you can do in the hospital and what possibilities we have for you, and then a couple of the medical options. I'm actually playing with the computer. Oops. It does go faster. So some of the non-medical options available in the hospital: repositioning in bed. I didn't say on there walking the hallways. We have birth balls. We have different things we can do with the bed, like the squat bar, and we have showers and tubs. So this is a labor bed, and I don't know if you want to go over some of the features, because you have that whole brochure.
Yeah, our labor beds are, for the most part, where you will probably give birth. However, depending on your provider and your communication with your provider, there are other options as well. but that's something you would probably need to discuss with your provider first if you wanted to do a water birth or something
Do they
different.
allow those at Wilson?
I
The
had one.
the midwives do, yeah, I had 2 water births at Wilson with the midwives. Some of the providers will, if you talk to them about it ahead of time and discuss what you would like. It really just depends on the different providers, so it would be something that you would wanna discuss with them first. But, but the labor beds are really kind of fully functional to where you don't necessarily have to lay on your back in bed in stirrups and deliver. We've got, you can see these pop up, those are, handles that you can hold on to help. These come up, you can position, we have different pictures, right?
Yeah, we
To
do.
position yourself in various positions in the bed, if that's what, you choose. So they're really nice, and the bottom breaks down or it doesn't. Some of the providers do what we call bed deliveries, where they don't take the bottom of the bed away. And, have you up in stirrups standing between your legs. So there's more options in terms of where you wanna be. And I just highly recommend, if you want something other than bed broken down, flat on your back, talk to your provider. I mean, oftentimes they do what's natural and comfortable for them, but if you express an interest in doing something different, they're usually open to it. But talk to them about it before you go into the hospital and tell your nurse about it. Tell everybody you see. If you have something in mind that you want, as soon as you get there, tell your nurse, tell your new nurse, tell your provider. Communication is the best way to kind of get where you want to be in your birth. So oftentimes, like I said, everybody's going to do kind of what we would normally do, but if you have a different request, we usually can accommodate it. We don't know if you don't tell us. So
And so a lot of people picture the typical birth with like back on your back in
Yeah.
stirrups. So there's stirrups that support your whole leg, but then there's also just this part comes up and you can
Yeah.
just put like your heel in there if you need something to kind of
right.
have a little leverage and then pull on the handles. The beds can do hands and knees. There's 2 different ways to do hands and knees.
I actually have 3.
Oh, in the bed?
Well,
Or-
I do one on the side of the bed too,
Oh,
standing up,
okay.
leaning over.
Oh, yeah.
Yeah, but there's various.
So for this one, I actually wouldn't have the foot lowered.
No, I
'cause
don't
want
see the
a little
point in
more
that, but-
support. But that's nice because it allows like pretty much hand level for whoever your support person is to do counter pressure or to get right. Like I've been kneeling on this part and doing a hip squeeze.
Yeah.
And if it's a situation where you do need monitoring, you're right close to that.
And you can also, I have been successful doing this with an epidural, depending on
Oh.
how comfortable they are with how their legs are functioning. So I'm maybe not in such an upright position, but the second hands and knees on the bottom, you can still do it with an epidural if it's an epidural where they're not completely, like legs useless. So some of these positions you can also move around with an epidural.
Yeah, or you could be like your knees down
That's-
on the
yeah, I
lower
think-
part of the bed and the foot
Yeah.
drop. There was another picture of that.
Okay. And there's also another one that I sometimes will do if you want to be up out of bed but still kind of want it or need to be in a hands and knees. You just stand on the side of the bed and you raise it and you just kind of lean over like this. So you still get the benefits of being upright, but you're also hands and knees, and it doesn't put so much strain as this one on your shoulders and your wrists. Because anyone who's been in hands and knees pregnant for an extended period of time knows, like, after a while your arms just don't want to hold yourself up anymore. So.
And we're just showing the bed pictures. It's not that you have to be in bed and that's the only
Yeah.
option, but a lot of people might want to be there for comfort or, just for the stability of using the bed for support instead of just your own body weight. This is one of my favorites if somebody has an epidural, but we still want to let gravity work. The foot of the bed drops completely, so you're sitting up, but you don't have your legs crunched all the way up against you. It allows you a little bit more space, and then you can even like stick a smaller birth ball there to keep the legs nice and wide.
And the legs can drop even more than that to the side.
Yeah, but it's a nice resting position. While it's still kind of active, you're still letting gravity work and put pressure on the cervix. Instead of being like flat on your back or even midway to your back. And that works, like I said, with an epidural or without. You are sitting on a birth ball there, right?
Yeah, I am.
Yeah, you can't see it.
Yeah, it's underneath. It's a big peanut one. That has the, yeah.
So the birth balls are really nice. As you can see here, they allow your partner or your support person to access your back. Sometimes we wedge them up against the bed so you can have something to lean on.
Mhm.
And then this one looks like you're just sitting on it.
I think that's during a contract, because after I would lean back against Patrick, so that way I
Okay.
could rest and not have to like support myself at all.
Yeah, we have your partner sit beside you. So the peanut's great because it's kind
It's
of
big.
like shaped like an 8-ish kind of thing, so it's very
There's like a little
stable.
divot to get into.
Yeah, and then we just have regular round birth balls.
How do you get out?
That's
You need help.
I find the best thing is to just stand and have someone pull it
Yeah.
on. Just, don't ever try and get on and off it by yourself. 'Cause
No.
it's like trying to get on a ball. It doesn't.
Yeah. But the bouncing can give you like kind of a rhythm, something to count to focus on during a contraction. The beds also, you can put squat bars on them, and that's more for pushing. Then you wouldn't really do this during like your earlier labor contractions, but that's just another option for delivery that we can do. Mostly I do this one.
Yeah.
We have someone put a towel or a sheet around, and it just gives you something to pull against instead of feeling like you don't know where to put your hands, like helping you kind of curl around your belly
Or
push your hair down.
Yeah. It's the same
pushing.
idea
So
of
kind
how-
of instead of pulling on your legs.
Exactly. Yeah, it gives you that same leverage. That's why we have you pull on your legs, because it gives you something to push against. It gives you that leverage to do that.
Yeah,
But
and
yeah,
you
this
could-
is nice because you can be more upright.
or you could put your feet like in the little mini, not the stirrups, but the other support
Yeah.
holes there. And you can even do a combination of birth ball and bed. You could also flip that around, do hands and knees on the birth ball. But we pretty much would have any of these. We have multiple birth balls. They're rarely ever all in use.
Yeah.
So all of these are possibilities. It can be really helpful. And then there's resting positions. There's the typical like your
That looks comfortable.
I've
Yeah.
actually never done that before, but I saw
I
that
haven't
picture and I was
either.
like, oh, that's amazing. Especially with an epidural, if your legs are heavy. I know you had said that you, like once you get the epidural and you're laying in bed, you're worried that it affects your progress, but
Well,
turning
yeah.
from side to
It
side
don't
and,
work for me. is
well,
what it is.
that's,
Yeah.
but also you can get an epidural and still have a nice progression of your labor by just, the bed is nice and able, so you're able to turn from side to side. You can even do an extreme almost on your belly to help, especially if your baby's like OP or something, you still need to get them to turn their. I'm sorry, it's a sunny side up, or what we call, babies usually come out facing the floor.
Down.
Yeah, down, and if they're born facing face up, they can do that. It's just a little bit harder because the widest part of the baby is coming out first. So it tends to increase pushing time. It just can sometimes be a little bit trickier. So if we can get the baby to turn before you start pushing, that's ideal. So when we
I
say
think,
if it's,
I think my last turned during a push.
yes, yeah, sometimes you'll see the head
Watch the
corkscrew.
head spin.
Exactly.
I was like, is
Yeah.
it spinning?
It's not like Exorcist, no.
Had you had a lot of back labor?
No, I didn't.
Oh,
I
okay.
had no idea that. I mean, in my ultrasounds, they said he was facing my back or whatever, and I didn't have any back labor. But I'm
That's
wondering if
surprising.
that was maybe a reason that I didn't have that pushing sensation too. I have so many theories.
Sometimes the way the baby's head comes down when they're OP, they don't really fill the birth canal all the way, just the way it is. And when you do an exam, sometimes you'll feel there's a lot of room behind the head. So sometimes if they're not really in there, you may not have that pushing feeling. So that could be.
And I know a nurse told me, not with the last one, but the one before, a really long labor, she said, to sit on the toilet facing the wall,
Mm-hmm.
and that would really just help,
Yeah.
with that.
Especially if you're at home where you have the tank. Our toilets at the hospital, you don't have anything to
Yeah,
lean
you
against.
yeah.
But if you're at home, you have that nice tank. You can put a pillow there and just lean back or lean against it, and that helps too. Yeah, I often, if patients don't have an epidural and can get up and move around and are getting towards the end, I'll have them go sit on the toilet for a while. So just go sit there, hang out, and see,
I did
it's
get
a really
stuck
nice
there, though,
position.
'cause I had
Yeah.
3 contractions in like 5 minutes.
Yeah. You're not moving after that. Yeah.
I'm gonna deliver this baby right here on the toilet.
It has happened.
Well, a lot of the squatting position people can feel uncomfortable just doing a squatting position on
Yeah.
the floor, but the toilet kind of, people are afraid that they're gonna like lose control and maybe they'll pee or something,
Right.
so the toilet kind of offers that stability and security that like anything kind of goes on the toilet. So I've had people move a few centimeters with a few contractions on the toilet, and that was kind of an extreme case, but she had that comfort and the squatting position, all of those factors mixed together,
Yeah.
you know, it allowed her to open up.
Because do you have a picture of the birthing stool? We do have a birthing
Oh,
stool, but I
no,
find
I
it to be very low to the ground and difficult
Hard
for
to get on
pregnant
and off.
women to get on and off. So the toilet, I think, is a better option anyway.
Yeah.
But we do have it, a birthing stool.
And this position as well, like, it allows you to rest, but still keep your hips and your legs open. If you're really getting towards the end, there's gonna be a point where you don't wanna like close your legs again, cause you want as much room as you can have in your hips. I don't have a picture of the full showers that we have at our hospital. They do have a removable head, so if you wanna just spray right on your belly, if you want someone to spray it right on your back, all the showers have a little flip down seat, so you can sit and spray it on your belly, or Kim mentioned you can hands and knees in the shower too.
You can, yeah, if you put towels or whatever down to help your knees, you can kneel in the shower and lean over the bench. I did that for a very long time with Grace. I was in it for a while. But yeah, I've done that with patients and it's been really effective. If they have a lot of back labor but they still want to be in the shower, it helps relieve that, and also they can spray their back and stuff, so that's an option as well.
Yeah, and half of our rooms have tubs, but they all have showers.
Yeah.
So that can be a nice, if you're planning on using the tub but you're not quite there yet, it can be kind of a nice like lead up to the tub without maxing out like your best pain relief option, which would be the tub if that's your plan. The labor tub, Kim generously shared pictures of her birth. I don't know if you want to talk about the tub because you actually have experience with it.
Yeah, I didn't have any medical pain medication during my labor, so I don't know, I can't tell you for sure, but getting in the tub to me felt like what I thought like a shot of fentanyl would do for someone else. Like as soon as I got in, it just helps you relax. It takes a lot, if you're having extreme pressure especially, it takes a lot of that pressure away. I just thought it was a really nice, comfortable place to give birth, and it's really easy to move around. With Isabel, I was on my hands and knees when I delivered. With Grayson, I was on my side, but I just felt like it was just a nice, warm, relaxing. And you had talked about the sensory. You didn't want to hear anything. You wanted quiet. I would put my head under the water during contractions, which they didn't love. They thought I was suicidal, I think. But for me, it was just, I didn't want people telling me that it felt like I'd be fine, everything was good. So I would dunk my head under the water, and then it would be quiet, you know?
That's cool.
So it did help. But I love the tub for delivery as well, just because a lot of that pressure and a lot of that burning, I felt like kind of went away, because it's just, everything's just floating, I don't know.
See, I don't know, like my third, I got in the tub and I had to get out because the pain just like maximized, and I don't, but she was born like 15 minutes later.
Right, and it's not, I think also, it's the timing of getting in the tub. If you're gonna use it to deliver in, you're not gonna get in the tub when you're 2 centimeters, because then you're maxing out your most effective form of birth or pain relief early. So if I have patients that say, I wanna use the tub for my pain control and nothing else, then I say, okay, well then that's our last resort. We're gonna wait until nothing else works, and then we're gonna get in the tub. And I think it helped. I think I was 8 centimeters when I got in the tub, so I had a little time to settle into it and get comfortable with it before I delivered. I always think it's important in any pain control option that you choose that's non-pharmacological to do it for a couple contractions, because patients will sometimes get into a position and say, oh, this still hurts, and I say, you have to kind of settle into it. Your body has to settle into it. So a lot of patients will do that. They'll get in the tub, couple contractions, and say, this isn't working, I'm too hot, I don't like it. And I sometimes will just tell them, just hang out for a little bit longer. Sometimes it just takes a little bit of time to really get the full effect of it. And some people just they don't like the tub. I've had patients that were dead on, they wanted to do a water birth, and they get in there and they're like, this isn't happening, I can't do it. So it's not for everybody, but for some people, I am a water person, so I knew that for me that would be the most effective way to be able to deliver and to birth, and it did work for me, but it doesn't for everybody. Plus, sometimes I think our tubs, we are better about, we have these like suction cup grips now that you can put your feet on, your hands on. Our tubs are quite large, so in terms of getting comfortable and not feeling like you're just kind of sliding around, I use a lot of towels, blankets for support. You can see they had a pillow in there. Because some people do feel like they're just kind of sliding around in there, they don't have anything to grip, they don't have anything to help them, like, stabilize.
What does
but-
she do? Is she like moving a jet or something?
This one here?
Yeah.
She had, I think, a cup of water she was pouring over me.
Oh, okay.
Yeah.
There are jets in there, and
There
some
are.
people find it effective to relax between and then use the jets only during a contraction. Because that, again, that kind of is like the maximum pain relief for them, so they want to save it up for
Yeah.
during a contraction and not use it the whole time.
I felt the opposite. I
I
didn't
didn't
want
like
the
the
jets
jets.
when I was contracting. Like early labor, I did get in the tub
Yeah.
just to relax, and it helped me dilate. But then I got out, and I did have the jets on early. But once I was like 8 centimeters, I didn't want the jets on.
No,
And I
I
wanted
didn't
water
like
a
the
little
jets.
cooler than it was
Yeah.
earlier.
Yeah, because you do get over, that's the one thing in the tub, you can get overheated quickly, because
Yeah.
we have our tub temperature set between 97 and
Yeah.
101.
Yeah.
So, and then when you go to deliver, they bring the tub temperature down more towards body temperature, just for the baby, but you get overheated quickly, so having something cool and, even a cool towel for your forehead and some ice chips or something like that is very helpful when you're in the tub as well, but. No, I didn't like the jets either, I wanted it just to be calm. And they always manage to come on right during a contraction, because I don't know, you can't control them.
Yeah.
Tubs have a mind of their own, so, but,
So just certain things to expect with the tub. The nurse probably will be taking your temperature a little bit more often than before, just to check that you're not getting overheated. And then they might do like spot checks or still have the band on, but they work in the water. And they try to have it as least distracting as possible. But they are waterproof, and if modesty is an issue for you, like, we don't care, we'll use as many towels and blankets as possible to make you feel comfortable.
well, this is the belly dance.
Yeah.
I just
there.
flipped it up over when I got in the tub, yeah. Because they were just doing spot Dopplers for me, so I just flipped it up. It worked really nice as a tube top.
Yeah, I thought it looked familiar.
But with my
Yeah.
daughter, I was not a labor and delivery nurse at the time. I just brought like a bathing suit top that I wore in the tub.
I thought I would wear something. I ended up being naked.
I think, best laid plans. I think
And I didn't care.
that you don't care. At some point, you don't.
Yeah, you never know how you're gonna feel or what you're gonna want.
Yeah.
There's another picture of the
That's
tub
with
just to
Isabel,
show you
yeah.
how big it is. Like, you could fully move sideways and then,
Yeah.
Okay, getting to pretty much there's 2 medical options that we use a lot. There's others that are a little bit more rare, so we're not really gonna cover those. We have the IV pain medication, which at both Lord's and Wilson is fentanyl. They used to use Stadol, Nubain, but they found that fentanyl, at least as far as I know, has minimal fetal side effects as far as on the baby's heart rate. And then there's an epidural. So fentanyl is a narcotic pain medication. It's given through the IV, so that means you have to have an IV running with fluids to be able to get it. You can get it usually once an hour, and Kim was saying yesterday, the timing's going to differ based on what your ultimate plan is. If you only want fentanyl and you don't want to have an epidural, then you might get fentanyl later as far as in your labor and your dilation. If you're planning on an epidural and you know absolutely that you want to get one, we might do fentanyl earlier to kind of get you active enough and to the point where you want an epidural.
Because the fentanyl does get less effective the more doses you have. When you get up to like 3-4 doses, you may find it doesn't work as long. It's not as effective. So if you are using fentanyl primarily for pain control and nothing else, if we give it to you at 2 centimeters, then when you really need it, it's probably not going to be as effective.
That's what I used with the last 2.
Yeah.
And because the 5th was such a long labor, I think I got it in like the 11th hour, and then she was born.
Yeah.
45 minutes later. It allowed me to relax
Exactly.
and,
Yes.
and open
Yeah.
up. So with my last, I was like, okay, I'm just gonna get it earlier so that labor progresses faster.
But it doesn't. Yeah.
I had 2 doses, and that's another theory, that second dose just, lost it for me. I couldn't, that's what made me not feel, so, another theory.
So you didn't feel the urge to push without an epidural?
I didn't have an epidural, just a fentanyl, and I just did not feel that urge. And it also could have been because I was 8 and my nurse said, "Are you pushy?" And I'm like, "Sure!" Let's
Okay,
go.
so you probably weren't just at a point yet where your
But
body
I know,
would
you
have
know,
pushed.
yeah, so,
Yeah,
I didn't wanna wait anymore, you know?
I know. With my daughter, I was 8 centimeters. I'm like, I'm pushing. I'm done with this. I'm over it.
Usually at that time, I would have that, you know,
Yeah.
urge, and,
It
but,
didn't.
yeah, so I don't know. Lots of theories.
Yeah.
Does it affect people differently? Because I really felt like it didn't do a thing for me.
It does, absolutely. Some people will say it doesn't work at all. It just makes me feel lightheaded, I don't want it. Some people, it knocks them out and they're completely comfortable and they are fine. It really just depends. I just tell
Yeah.
people it takes the edge off.
Yeah,
Yeah.
that's what
It helps you
just gave me-
relax between contractions, it helps you tolerate the contractions a little bit, but it does not, by no means does it take the pain
No.
completely
I
away.
just remember
Right.
thinking, this is great.
Yeah.
Yeah.
And sometimes it's just timing, you know, like if you get it, if you time it just right to where you're uncomfortable enough to where you're not able to relax and you get some fentanyl, sometimes, like you said, people just dilate the rest of the way and are done. But it really just depends. It depends on what baby it is for you, where you are in your labor, how quickly you're progressing, but it can be very effective. Some people can
Yeah.
do it like just to do the fentanyl.
I
It really
had
just depends.
someone like who had planned on getting an epidural, and we gave her fentanyl at 5 centimeters when she was getting really uncomfortable. And I don't know if you guys have heard about Ina May Gaskin's sphincter theory, that the cervix is almost like if you're tensing a lot, it's really hard to let it open
You're fighting
up.
what your body's trying to
So
do.
it was just enough to get her relaxed and like loosen her muscles, and 30 minutes later she was 9 centimeters. So that's kind of the extreme. I wouldn't promise
Yeah.
that to any
Well,
patient
that's
who's
what
getting
I went
it,
from
but
4 to 10
Yeah.
in
Yeah.
45 minutes.
that's when it works really well, and when
Yeah.
the timing is
And the epidural
Ideal.
sometimes too, if people get to a point where they just can't relax, sometimes that epidural or fentanyl,
Yeah.
whatever it may be, or even the tub, whatever your pain method is, helps you relax enough just to let your body naturally just dilate. Because if you're tensing up, you're fighting against what your
yeah.
body
If
is
you
trying
need
to
that
do.
if your original plan was to have nothing and to be relaxed, you might need to alter it to get to the relaxation point.
Yeah.
And like that's okay. So the pros of fentanyl. This is in contrast to an epidural. It doesn't confine you to bed. We usually say stay in bed for 20 to 30 minutes after, just in case you get dizzy or nauseous, because it is a narcotic pain medication. So you'll need to be monitored for a little bit longer than if you were just no medications, intermittent monitoring. But unlike an epidural, you can get up and walk around after once it's kind of out of your system. It begins working quickly. And like we were saying, it can reduce anxiety and help you relax. And compared to the Stadol, the new P.A.I.N, the American Pregnancy Association said that it had less fetal side effects. So the cons are, well, with any medication, the effect that it has on you, it's going to be passed down to the baby to some degree. So the relaxation effect that it has on you can sometimes be reflected in the fetal heart rate. And it's usually nothing we worry about. We just know that, okay, that's someone who just got fentanyl, and usually the baby perks up after that.
Yeah, well, I know, when I was pushing and the baby nurse came in with number 5, I'm on 7 by the way. She, the labor and delivery nurse said she had some fentanyl, and the baby nurse was like, great, like 10 minutes ago. I wanted to smack her so bad.
Oh.
Yeah.
And she looked like she's probably 20, never given birth, you know?
It is, yeah, we do have to be a little careful with, we say it doesn't have adverse effects on the baby, but we do have to be a little careful with the proximity to birth that we give fentanyl, because if baby's inside you, they're still attached to the umbilical cord, they're still getting kind of everything they need. So if they get sleepy, if they kind of zone out with the fentanyl, your body's there to help, help the baby recuperate. But if we give you fentanyl, they're born, we cut that, and they're still feeling the effects of it, sometimes it takes them a little longer to perk up, to really get, breathing down. So there is a time where we may tell you, it's too late for fentanyl, we can't do anything at this point. That's not to say, sometimes people get fentanyl delivered 10 minutes later just by
just because of
and it is what it
It was
is,
longer
maybe
than
that's
10
fine.
minutes,
Yeah.
just the way she said it.
Yeah.
Just,
And it's not a hard and fast rule for the cutoff point.
No, it isn't.
Like if it's your 7th baby and you have a history of 2-hour labors, then maybe at 8-9 centimeters might be too late. But if it's your first, you could be 10, but the baby's still way up there.
Yeah.
And that's not too late. So it really is from person to person. It depends on so much, like how fast you've delivered in the past.
Right. And it could change from birth to birth too.
Yeah.
I mean, last time they may have given you fentanyl 20 minutes before birth, and the next time they could say, well, you know what, it's your 7th baby. We probably want to refrain if you're feeling pushy in 8 centimeters. So it really just depends on what the situation is, how the baby's looking, how you're looking. Same with the epidural. I mean, we'll talk about it more when we get there.
So
but
you can be 10 centimeters and not ready to push?
absolutely.
Yeah.
Yeah.
You could be 10 and then we go by station where the baby's head is,
Yeah.
basically in relation.
That
So
was
you could,
sweet.
I had some people be 10 and like still need to, what we call laboring down
Yeah.
for a couple hours.
We use, I mean, laboring down is most effective when a patient is very comfortable. So often with an epidural, if it's your first baby, even if you're fully dilated, not feeling an urge to push, even if the baby's head's low, sometimes I'll still let people labor down until they really feel more pressure or an urge to push. Or I've had patients who are not epiduralized who labor down, who just don't feel an urge to push. If they're fully, you don't necessarily have to, because pushing is hard work. So the smallest amount of time you can push, the better. So if you're comfortable, you know, relatively speaking, if you can tolerate labor and not feeling an urge to push, sometimes it is more effective to just let your body push the head down on its own and then push when you feel ready.
It can reduce that really hard work time of pushing. If you start pushing just because you're fully, just because you technically can, it can take a long time to work that baby down, and there's not really any, like the time difference from starting to push just because you're fully and the time difference between laboring down and then pushing later, it doesn't make the baby come faster just because you start pushing. Because you could get tired, you know. I would
Right.
recommend waiting for the urge to push.
I think it's the same amount of time whether you labor down or whether you push.
Yeah.
It's just the amount of time you're actively pushing. It's just sometimes it's nicer to just kind of let the baby come down on its own. But again, I mean, you could be 9 centimeters and feeling pushy and start pushing because that's what your body wants to do. A lot of it is just listening to your body and its cues and what it's trying to tell you about your birth. And sometimes it's, you know, if you have a good epidural and you're not feeling anything, sometimes it's listening and trusting your nurse or your provider and saying, you know, yes, you're fully, but I don't think you're ready to push yet. Let's let the head come down, let's let you rest, it's been a long day or whatever, and let's wait until you're really feeling an urge or the head comes down more. I really just...
So we'll go over epidurals. So you said you had an epidural and it didn't work.
Yeah, I had 2. The first one, I mean, it was 17 years ago. So maybe they've gotten better. I'm just kind of afraid to try. You know, they gave me one, it didn't do anything. The second one numbed like my left leg, and that was it. And he was the most painful birth I've ever had. So.
Yeah. Well, especially if you're planning on an epidural and you're thinking it's going to
Well,
work
I
and then it's like
wasn't,
derail.
though. I wasn't.
You weren't?
The nurse talked me into it.
Oh.
So finally I was like, fine, okay. You know.
Well, that's even worse, I
And then
think.
it didn't
than
work.
when
Yeah, that's not even your idea. So the epidural, it goes into this epidural space in your spine. It's a very particular kind of place to be putting this very small but long needle. And then just the flexible part of this IV catheter remains, so the sharp part doesn't stay in your back the whole time, kind of like with an IV, but it's in your back. And then you'll have the tubing draped up, and it's connected to a continuous infusion. So I think some hospitals have like buttons where you can, almost like a patient controlled, where you can decide when you need it. But at our hospital, and I think at Lourdes, it's a continuous infusion. So it doesn't go away until we turn the pump off. And the medication continues. It's a local anesthetic, but it goes, so it's numbing from about here down. You don't want it to get higher than that. The ideal epidural, you don't want to be completely numbed and not be able to move anything. It should block a lot of the pain, but still let you feel the pressure, the urge to push. And ideally, unlike the one you had, it should be on both sides of the body. Sometimes you can have like a hot spot or have it be kind of one-sided, and we'll be trying to like turn you and get it to go over to that side if like your left side hurts more. But you know, they're not all perfect. The ideal epidural would work from like here, and then you'd still be able to maybe help move yourself a little bit instead of being completely numb and unable to move anything.
But I think it is a common misconception. People think when they get the epidural, they're going to be completely sensation-free. And that's not the case. In fact, my idea of the perfect epidural is you don't feel contraction pain, but you still feel that pressure. Because when you're contracting, when it feels time to push, you'll feel that pressure. It'll give you something to push into, and you'll know when you're contracting. It's hard when you're sitting there and the nurse is saying, okay, you're contracting, now it's time to push, and you feel nothing. You can't even feel where or how you're supposed to push. So I think a lot of people when they come in to get an epidural, and I do warn my patients that you're not going to be completely sensation-free. You'll be pain-free, hopefully, but you may still feel a lot of pressure. The epidural does not get rid of that, if that is what occurs, but it's a good thing. It helps your body to...
And there's like 30% of people it doesn't work in, right? Me being one of them.
I don't know the specific percentage, but there is, there are quite a few I find sometimes it just doesn't work. Maybe it's your anatomy, maybe it's the anesthesiologist. Sometimes people feel it on one side and not the other. Sometimes they get what Katherine said is a hot spot. You just get like one spot. And I feel like sometimes those people have a harder time because it's just one localized spot.
I had someone with like rib pain.
Yeah.
And it shouldn't be going that far up.
Yeah.
But for whatever reason had rib pain, so that was a distraction, even though everything labor-wise was comfortable.
Right. And that's not to say if you had an epidural that didn't work last time that it wouldn't work this time. It's kind of just one of those things that you have to reconcile. What is it worth? Is it worth going through the process of the epidural, knowing that it might not work, or it may, it's something, it's a hard decision to make. And we do have patients that come in and say, I got an epidural last time and it just didn't work. And sometimes they go through and have another and it works beautifully, and sometimes they say, it's just not worth the process. I'll just do without, so.
Yeah, I've had someone who said they had like a one-sided epidural before, and that the next time they'd rather be able to move instead of, because even if you have the one-sided epidural, you're still in bed, so that can be difficult. And we'll go over that on we're doing a basic pro and con. The pros, like we said, it can help you relax between and even during contractions. Sometimes there's this really nice, beautiful, restful period, like right when the epidural starts working, where they've been exhausted, they've been working hard, and they can just sleep for a little while, and then they might wake up and be a little bit more dilated. I had someone a few weeks ago who her water had been broken for a day, probably a day at that point, maybe even a little longer, but had been very uncomfortable, but whose cervix hadn't changed. So the epidural was just what she needed, and she rested, and then throughout most of her labor after that she was like laughing and very comfortable, but still felt that pressure and could still move her legs. So that was really, really nice for her. And like Amy was saying, you have to know how you usually deal with pain. If you're the kind of person who just medicates completely everything, like the second you get a headache, then an epidural or fentanyl and then an epidural might be something for you. You just have to know what you need. And like with the epidural, like we said, with a good epidural, we can still reposition you. You're not going to be stuck flat on your back. So the stirrups we showed you earlier, like we could turn you to your side and have you support your legs. We could do the sitting upright position, and hands and knees even a possibility.
We've done it, in extreme situations. I mean, it wouldn't be something that I would just say, oh, you want to get in your hands and knees.
Okay.
But we have, if a patient has a nice working epidural and maybe the baby's not coming down or feels like they're OP and they need to flip, if the situation arises, I have gotten a patient up in hands and knees and with an epidural. But all the clouds the moons have to align and everything has to work well for that to happen. But it's not often.
It wouldn't be your choice labor
It wouldn't
position.
It's not like I routinely put patients in hands and knees.
So then some of the not so good things. So before you get an epidural, once you say that you want an epidural, we would start if you didn't already have an IV, we do a lot of fluid through the IV because the epidural can lower your blood pressure, so we want to kind of prevent that from happening. Once you have an epidural, the fetal monitoring is continuous versus it might have been 15 minutes, 30 minutes here and there before. The placement, the position that you have to be in to get the epidural can be difficult. Like, for some people, those are the hardest contractions, when you have to stay still because it's such a particular spot in your back where the anesthesiologist has to put it. A lot of people think, you know, the benefit is worth that difficulty of sitting for the epidural. So.
How long does it typically take for the anesthesiologist to, like, how long would they have to sit in that position, would you say?
It really depends on the
Varies.
patient and
Sure.
the anesthesiologist. I would say usually minimum of 10 minutes. I mean, I've had quicker ones, but that's been
10 is pretty
sometimes
quick.
up to 20 minutes in that position, but it really just depends. I do think that if you hold the position, the better you hold the position, the quicker it goes. The more relaxed you're able to be, the quicker it goes. There are some anesthesiologists that do quicker epidurals than others too, which is kind of, but I would say 10 to 20 minutes is a good time.
Well, that was my big turn off, you know, and one of the nurses had to talk me into it, because I'm like, I'm gonna be contracting and they're gonna put a needle this close to
I
my
know.
spine.
Yeah.
What if you paralyze?
They'll
the
try
baby?
to
if you
wait
think
for the
about-
actual needle between, but
Yeah.
then once it's in, they have to do some things to set it up.
Usually, I would say patients should have like three or 4 contractions
Yeah.
during the process of the epidural. Because if you're contracting every, let's say, 2 to 4 minutes on average, and it's a 20-minute period, I mean, you know, it's not like you're
That's,
continuously contracting. And they do try and work with you a little bit on when you're contracting and when they're going to do things. But there may be a contraction or two, yeah, where you have to hold as still as possible. And that is a hard thing for some patients. I think all patients to have to
Yeah.
do that, you know?
Well,
But-
and it's a position that it's not very intuitive. It's kind of like Twister, like everyone's telling you all these different things to
Yeah.
do. They're like,
It's not something you naturally
have
do.
your shoulders, but put them down, but don't arch them, and then push your back out.
Push your back out, but don't lean forward.
Yeah, like push like an angry cat or a shrimp. And if you've never done that before, that can be like frustrating to be
Yeah.
telling.
Plus you have a big old baby in there that you're trying
Sometimes I
to.
practiced before.
Yes,
Yeah,
yeah.
really though, if you're
Practice
planning on
your
getting an
epidural position.
epidural, like it would be nice to know what the position is. Because basically, your vertebrae are like this, and they need to open a little
Yeah.
bit, and they're down here, and that's not a part of your back you usually arch. Usually it's up here. So
I think it's hard enough to do not pregnant, and then you put a baby
Yeah.
in there. It's like, I don't know.
Yeah, it can be difficult, like in the midst of labor.
Yeah.
And
And then it also is important to remember, I think a lot of people think as soon as that epidural catheter in, bam, pain's gone. But it can take 20 to 30 minutes for the epidural to be what we call the setup, for the
yeah, they
medication
do
to get
test
in.
doses.
Yeah, go where it needs to go. It's not to say that you won't gradually start to feel pain relief as it progresses, but it's not like instantaneous, which I think is sometimes factors into the timing of the epidural. I've done epidurals up to 8-9 centimeters if you're not progressing quickly, but sometimes we'll have, you know, if you have a multip that comes in that's 8 centimeters and wants an epidural, I never say no, but I always warn them, like, by the time we get it in and it gets working, it may be too late. I mean, it's something that we can certainly do for you, but that's also something, if your nurse says, you know, there may not be time, it may just be factoring in the anesthesiologist coming in, placing it, getting it to work. It may not.
Getting the IV started, like if you
Yeah.
come in and you're just rip-roaring in labor, there's a bunch of things that need to happen. There's lab work that the anesthesiologist needs to have your platelet count. So I've had a situation where it was her second baby, and everything's set up, and we're literally just waiting for the platelet count because they can't do it without it. So, you know, the timing, like with any of these pain control measures, the timing is really can be very important. So that's the end of our show.
I think the most important thing to remember when you're going in to have a baby is if you have a birth plan in mind, to communicate it to your provider beforehand is even better. On your office visits, communicate that to your provider, communicate it to your nurses, but still allow some flexibility in your mind, because sometimes things arise that you're not ready for, we're not expecting, and sometimes things can change with what you were planning. And in the end, a healthy mom, healthy baby. It doesn't matter how you get there, but that's the goal. So, you know, whatever your plans are, we try and, you know, accommodate them and do as much as we can to get there. But I think I find some moms, you know, they come in with this distinct plan in their head, and if it deviates, they feel somehow that things have gone wrong. And it doesn't. You have a beautiful baby, you're good, you're healthy, and that's really all that matters in the end. So when you're going in, no matter what you choose for your birth, that's the most important thing to keep in your mind. As Amy said, like, the baby is the outcome. That's what you have to keep thinking in your head.
Because I know some people get so upset, are they to have the birth I wanted?
I know, they think they failed, and that makes me so sad that there are these women out there that think that they failed because they got an epidural or because they didn't do what they thought that they were going to do. And you're still a mom in the end, you know, and that's the most important thing. So.
And I would suggest if something's really important to you, like if you think you're going to like massage during labor, if you think you're going to like position changes, practice them ahead of time. Because when you're feeling the discomfort of labor, that's not a great time to learn something new.
Yeah.
So like Amy was saying, read those visualizations or practice the meditation, because we have, you know, people come in and say, in theory, they like those things, but in practice, they haven't practiced before. So, I mean, something might work for you in labor that you've never tried before too, but if you are set on something really appeals to you, you're picturing your birth in certain ways and certain things that are going to happen, practice those ahead of time so you'll be more comfortable once labor happens, because then you know, it's hard to do those things with like a big belly and being in pain. So if you've practiced ahead of time, like doing prenatal yoga for the position changes, anything like that's going to make it easier once labor comes.
Does anyone have any questions?
Any questions? You're the only one here that hasn't done this before. So.
Yeah. Cool. Okay. Well, thanks for listening.
Thank you.
I just literally